Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation during the COVID-19 pandemic. I'm joined by Zachary Steele, Assistant Professor of Theater Practice and Director of the Medical Clown Program at the USC School of Dramatic Arts. Hi, Mr. Steele.
Hello, thank you for having me.
It's so nice to have you. Today, we're going to be discussing what is medical clowning and the importance of clowns in helping getting through a difficult experience, including this pandemic. So, Mr. Steele, can you tell us a little bit about yourself?
Yeah, I have been working at the School of Dramatic Arts as a faculty member, I think for 7 years now. My background is in acting, in theater. That's what I went to school for, and that's what I did professionally before I started working as a teacher at USC. And part of the training of an actor is clown. It's to kind of get you in your body, to get you comfortable with failure, to get you comfortable with being funny and being ridiculous and kind of being impulsive in that way without any shame around it. So as to encourage that kind of feeling in your audience. I fell in love with it as a part of theater training. And when I became a teacher, I discovered that there was a medical application to the practice of clowning, that there was actually a use in it in the healing process. And it had been going on and it had been practiced for a few decades internationally. And so I was very intrigued by it. We actually hosted a conference for medical clowning at School of Dramatic Arts, became very informed, started practicing it myself, and from there had the idea to formulate the first and only kind of university-affiliated training program for clowns. So now I not only practice it, but I train undergraduate USC students to come with me and clown with me in the hospitals.
Can you tell us more about what is medical clowning and what is the medical clown program at USC?
Sure. So medical clowning is the practice of bringing clowns into the hospital to improve the lives of hospitalized patients and their families and hospital doctors, nurses, and hospital staff through joy, through laughter, through improvisation and creative engagement. We are not birthday party clowns in the sense that first of all, we don't look like that. We don't wear makeup because it's very intimate interactions that we have. We know as human beings that children in particular get a lot of information about who you are as a human being and where you are emotionally from just looking at your face and being able to get that information visually. So we don't want to take any of that away by wearing a bunch of garish or obnoxious makeup. We actually our intention in the way we look is to be beautiful, something in contrast to the kind of drabness of the hospital experience, the colorlessness of the hospital experience. We want visually, when we are seen in the halls, to trigger something in the patients. Oh, this person is something different. This person is here to break up the monotony or the anxiety or the worry that I am living within, and to interact in a different modality. So our practice is very, very much improvisational, because we really want to focus on what the person in front of us actually needs and actually wants, not necessarily imposing our idea of what we think entertaining is or what we think funny is or what we think joy is, right? The clown is actually there to learn. The clown is there to listen and respond in a playful way, kind of a translator of the moment in a joyful way. The program at USC for the undergraduate students is training them in that technique. And you can imagine it's very kind of intricate, and it has a lot to do with spirit or state of play, as opposed to teaching them actually how to juggle or how to play the ukulele or how to do a magic trick, which are all helpful things to do in the hospital, but actually are kind of not really the vital or the fundamental elements to what you need to be a clown in the hospital. What you need are listening skills, play skills, understanding what play is, skills of empathy, and skills of expression, and being able to use your body in expressive ways and fun in different ways. And so that's what we teach the students, and we teach them the kind of history and the theories of medical clowning and how it's effective. And then we bring them into the hospital with me so that they can clown with me and experience it themselves.
What would a patient, then let's go pre-COVID, and then we can talk about how the pandemic has changed things, but let's go pre-COVID. If a patient was in the hospital, what would your role look like? What kind of things could they expect? What's the environment? What would the experience be like?
Sure. So there's various roles that we play. As I said before, it's important that we don't enter into any interaction with any sort of agenda. Okay, first I'm going to do the juggling, and then I'm going to say this joke, and blah, 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 blah. We might be doing the rounds in a pediatric inpatient unit, knocking on doors. We use censuses, so we have people's names. But really, we just knock on doors, and the first thing that happens, which is one of the most important things that happens, is we open the door and we say, "Can we come in?" And the patient sometimes says yes, sometimes says no. Oh. And if the patient says no, we go away.
Okay, all right.
And that sounds very simple and insignificant, but actually it kind of alludes to a fundamental role that we play in the hospital, which is to empower the patient. Mm. And when they say no and we go away, they might have the thought, wow, I wanted something and it happened, which isn't necessarily always the case for a hospitalized patient, right? Doctors might ask if they can come in, but in the bottom of your heart that they need to come in. The nurses need to come in because they need to redress you. They need to fix your IV, et cetera, et cetera. You are very powerless in various lights when you are in the hospital. You've been removed from the thing that you are familiar with and brought to a very unfamiliar place where everyone knows more than you do about what's going on. The clown, in their role as the fool, takes that lowest rung of the ladder away from you and gives you authority over them. And that is a very important part of the thing that we do. So that kind of relationship can carry through to the work that we do, right? We do a lot of object work. We do a lot of wrongness, is what I call it, which is using things in the wrong way so as to give the patient an opportunity to correct us or to laugh at how silly we're being. That happens quite often, and it's very effective. It empowers and makes patients feel smart and makes them feel more together than something, right? No one is more lost than the clown. Other things that happen in the hospital are, like, for example, I mentioned nurses come in and redress wounds or things like that. The clown can act as a sort of distraction tool during those things so that we can refocus the attention of the patient on something that is fun, something that is enjoyable, something that is funny. We use music a lot. There's a lot of intubated patients in the intensive care unit that we visit who aren't necessarily conscious, but aren't necessarily completely shut off to all experience. And we serenade those patients sometimes we do dances in the hallway. Sometimes I ask nurses if they would like to dance with me. Very often I am rejected, but still it's still okay. I will continue dancing and I will always be there for them. They might not be there for me, and that's okay. My ego is not a part of this.
So adults, kids, everybody's part of the party.
Oh yes, everyone. And that's also, like I said before, there's a communal element to the clown, right? A patient might be sharing a room with another patient and be divided by a curtain, and they would never communicate, because that's how we exist. That's how we stay safe. That's how we stay comfortable. And I completely understand that. And there's very, very valid reasons for us to want that kind of privacy and isolation. But the clown kind of breaks those barriers and provides the opportunity, no one's forcing anyone to do anything, but the opportunity for connection between people. They can connect in a safe way through the clown and be laughing together, and then make that connection, so that even when the clown leaves, that there's something there that happened that still exists.
Well, I'm sure that the pandemic has affected that immensely.
Yes.
Can you comment on what your role looks like now?
So we're not in person at all. And we are instead, we have created a virtual clowning program, so that patients who have tablets or computers, or through Child Life, who actually does have access to those, which is a social worker organization within the hospital, those hospital staff have access to those things and can connect us to the patients and their families, and we can interact virtually via Zoom. And we've been doing that. It's been wonderful. We were very concerned that we wouldn't be able to do what we do. It is, of course, limiting and not as impactful, I would say, but we are still able to experience joyful interaction and make people laugh and make people smile over Zoom. And so that's been absolutely wonderful.
Wow, thank you. I'm so glad that you're able to do that. I'm sure that even you described that sometimes you're in the ICU and you're in difficult patient situations and rooms. How are you able to maintain a positive clown attitude in these sad and difficult situations?
It's the same kind of resilience, I think, that our nurses and our doctors build up. It's interesting. Before I started doing it, I was like, I had the thought, do I have the constitution for this? I don't know. I've been in the hospital a few times for various things, but I haven't just gone into multiple hospital rooms and interacted with patients with various injuries and various illnesses. So I don't know. And what I discovered was that once you put on that nose and you get into that spirit of play, that there is a level of courage and resilience that you acquire organically. And I think it's the same with putting on the scrubs for nurses and doctors, that you didn't think you would have beforehand. When you just commit to something, and say, this is what I'm going to do today, then you kind of are more ready than you thought you might be. I am not saying that we are like invincible. Of course, these things do have psychological effects on us and impact us emotionally, especially when we're dealing with death or near death and serious illness. And it is extremely important, and I stress this in my teaching, to have support of your own, to have counseling or therapy or some sort of what is called in the clown industry emotional hygiene, to support you, so that you aren't left out to dry when you leave the hospital, that you have somewhere to go to.
That makes a lot of sense.
Yeah.
Do you find that some patients have a paradoxical reaction to a clown coming into their room, especially maybe during Halloween time, or that, I don't know, does that happen?
Yeah, it happens. It happens less frequently than you would imagine, but it does happen. And sometimes it happens because specifically we look like clowns and they have seen it or something, and we remind them of that. That, I could count on my hands how many times that's happened. That is very, very rare.
Oh, wow.
But what does happen is a reticence, is an instant reticence. They see us and they don't go, "Oh, clown, come play, yay, woohoo!" They do the opposite. They go, "Mama, or they hide or they shrivel up a little bit. And that is so completely understandable, because we are not only are we a stranger walking into their room, we don't look like a nurse or a doctor, which maybe they've become accustomed to. But we also look out of place, which is kind of the point of who we are, but also might elicit that reaction from a patient. And it is our job to either go away if they say go away, or to, through subtle, very sensitive gameplay, to win them over.
So tell me, what do you think is the most meaningful, or what do you think you get out of it personally, working as a clown?
Well, it's changed my life. Clown affords me and anyone of my students or anyone who does it with me the possibility to interact in these really meaningful ways with people who are completely different from us in so many ways, culturally different from us, who have different interests, who are of different ages. And that is just so endlessly valuable to me. And also to see people who are struggling health-wise, right? So that kind of keeps us humble and allows us to be so appreciative for the things that we have and the health that we have, which I think we very often take for granted.
Thank you for that. Thanks for your thoughtful explanation.
Sure. Yeah. Thank you.
What would you say is the most difficult part of your job then?
It's the tragedy, I guess. The knowledge that the people that you're interacting with are in serious situations very often, and we are willingly putting ourselves into relationship with these people, but I can't deny that it doesn't have an impact on us. And although the kind of ideal of the clown is to live purely in the moment, we're still human beings, and it's, once you leave the hospital room, to have those fantasies of what's going to happen with our patient and is very difficult. So, but I don't want to be precious about it, because I know that, we are only experiencing a fraction of that, and our essential workers, the nurses and the doctors, and you, Dr. Keshishian, are experiencing that, that's your job on a daily basis. So it's not like it's unique to clowns, but I think it's a similar struggle that medical clowns have to those professions.
Absolutely. I mean, it's a team effort, and it really is a medical team, and you're part of that medical team.
Yeah.
Do you have a special memory during the pandemic that you could share with us as a medical clown?
Yeah. So what we had kind of a revelation a few months ago that, and it happened because a woman in Hungary who was in quarantine heard about our program or found us online and signed up. She wasn't hospitalized, but she signed up for a session with the clowns, for clowns to visit her via Zoom. And we assumed that she would be in a hospital in Hungary. And we started the Zoom session, and she was just in her house. She was just in her very nice seeming house on her laptop and sitting in front of her computer. And at first we were like, oh, maybe she has a kid who isn't feeling well. That was the clown's assumptions, and she's just introing it. But we soon realized that no, she was calling because she wanted to interact with clowns. She needed that for herself. And we had this beautiful interaction. I actually wasn't a clown, I was observing. But the two clowns had this beautiful interaction with her. And it turns out that she apparently didn't have any serious illness, that she was just suffering from something that all of us are suffering from right now, which is isolation, loneliness, and potentially depression, anxiety, some combination of all of that. And we realized in that moment that, wow, we actually don't need to limit ourselves to hospitalized patients, and that everyone is suffering in their own way, psychologically, physically, and can use the benefits of interacting with the clown to enliven them in these moments when they might be a little bit depressed. Um, and obviously everything is exaggerated and enlarged because of the isolation of the pandemic, but loneliness is, I think, kind of a global epidemic even before COVID-19. And it was this a really, and because of the beauty of that interaction and how thankful and grateful she was for the play that she engaged with those two clowns, we then now have opened up our program to anyone who's interested. And so we're empowering everyone in the world to decide if they can benefit from interacting with medical clowns, and not up to us to determine whether you are worthy or not of our service. So yeah, that was a very meaningful interaction that I had, and it was an adult, and I love making adults laugh because it's hard. It's hard, but when it happens, it's so gratifying. So.
Wow, I can call you up sometime for a medical clown session?
Yes, you can. Anyone who's listening can call us up. However, you are suffering or not suffering, you can interact with clowns. We are available for you.
How do we do that?
If you Google USC medical clowning, you will come to the website where there's a sign up sheet.
Great. Okay, we'll include that link. Perfect. Yeah,
great.
That's great to know. Like you said, during the pandemic, there's a lot of isolation, anxiety, fear, and it's really hard to connect with others, especially because we are asked to physically distance.
Yeah.
Do you have any thoughts of how people can help one another through laughter during this time?
Okay, yeah. So I think this is going to be a simple answer, and maybe it's a little bit of a cheat, but in order for people to know that you're funny and to laugh at you, they have to hear from you. So my advice would be reach out to people. And I know that's happening a lot, which is such a beautiful thing. But to reach out to people without any agenda. So you don't, in times when you don't need anything from people, just to talk, where there's no like, okay, so here's the thing that I need to ask you. Here's another thing I need to ask you. What do you need from me? So that we can just experience each other in the moment and see what happens and be uncomfortable. Be okay with being uncomfortable. I would say that is my advice.
That makes a lot of sense. Thank you.
Yeah.
Can we get something to make our listeners laugh? Even a knock-knock joke. I'll take a knock-knock joke.
Okay. I have a joke.
I love it.
Yeah. Okay.
Okay.
But before I tell the joke, I do want to say that that moment where you said, "Can we get some sort of skit or anything to make us laugh?" and I go, that to me is clown, right? That kind of unpreparedness and silly, like vacuousness is the kind of spirit of clown that I'm talking about in terms of improvisation versus shtick. But here's some shtick.
All right, we're ready for the shtick.
Okay, here we go. How do you catch a unique rabbit?
I don't know. How do you catch a unique rabbit?
Unique up on it. How do you catch a tame unique rabbit? Tame way, unique up on it.
That was great. I love it. Well, thank you so much. I really can't thank you enough for your time, and thank you for the work that you do. And
Thank you.
we all need a nice laugh.
Yes, we do.